All right. Hello and welcome, everybody. Please dream of lunch while we talk about this so you have nice big smiles on your face. And that would be really nice. I'm sorry that we have to do this just before lunch, but I think it is important for us to be speaking about chronic illnesses and mental health. I'm going to be referring to my phone and my book because, yeah, it took me a while to write it down. I'll also get the panelists to introduce themselves before we begin. Mai, would you like to start?
Yes, sure. Hello, everyone. My name is Maya Alwi. I'm from Egypt. I'm a counseling psychologist and a psychotherapist. I also teach psychology at university. I'm the founder of Raising Happy. It's an organization dedicated to mental health awareness and family wellness. Thank you.
Hi, good afternoon. I am Seema Rekha from India. I am founder of Antarman Consulting Private Limited. Our team and I help organizations providing solutions in corporate wellness, primarily on mental health. So we are helping millions of employees and leaders in India and Southeast Asia. Helping them day in out with wellness strategies, primarily in mental health. We are doing assessment, diagnostics, and interventions every day for employees and separately for leaders. So this is me, yeah.
Good afternoon already, is it? My name is Gerlinda. I'm from Cambodia, working for the foundation that you've heard earlier already. I am a doctor by profession and also a global health professional. So I'm the only doctor here, but I'm also not the expert with mental health. However, I've seen many in our hospitals. What are the chronic diseases doing into the mental health of our patients? So I'm looking forward to interact with you about that.
Very good afternoon to all of you. I'm Huma Anis from India, and I work in the pediatric oncology field. I work with cancer patients and their caregivers.
All right, thank you. Hi, everybody. I'm Nitya J. Rao. I'm a co-founder of Heart It Out. We work in the space of mental health and well-being, and I dream of providing accessible mental health to 1.5 billion people by 2030. It's an impossible dream, so I'd like all of your help. And I'm super excited to be moderating a panel with all women here today. And I'm so excited to be blessed with this honor. Thank you. It's a difficult topic we're going to be talking about, chronic illnesses and mental health. So I'm going to try and add as many jokes as possible. So if it goes too dark, please let me know. 60% of us live with chronic conditions like diabetes, asthma, arthritis. And we die with these conditions with comorbid mental health issues like depression and anxiety and mood disorders without even knowing that we had them. In my practice, I found that many clients who live with chronic conditions were never aware of it. Even when they come to psychological care or therapy, they weren't very aware that they had these concerns in the first place, nor are they informed by their primary physicians, their healthcare physicians. So I'm going to direct my first question to May. How aware are people in your practice, because I know you practice as a psychologist, when they come to you with their chronic health issues, how aware are they that this has also resulted in psychological distress?
Well, that's a very important point because I don't think all the time they're really aware that it's not just related to their chronic illness, that there is a psychological part as well. And sometimes, to be honest, it's not very easy to differentiate because a lot of the chronic illnesses, for instance, are already making me tired all the time, having problems with my appetite or with my sleep. So sometimes the clients are not really sure if that's because of a psychological issue or from their disease. And I think that this is a very important part because this tells us a lot about the importance of awareness about the mental health issues, because I think we've we were just discussing how this has been very clear in the last couple of years that we can't ignore the fact that mental health is a crucial part of our wellness in general. And when everyone was talking about immunity the last couple of years, I don't think we can ignore the fact that our psychological wellness is highly powerful and has a lot to do with our immunity. So sometimes clients are not aware, and I just wonder if, to what extent are their physicians talking to them that a lot of what might be happening, or at least something can really help if you work on the mental part or the psychological part of the diseases in parallel of working on the physical part.
Yeah. And from a physician's perspective, have you found that there is either ignorance or stigma, or do they even carry the psychological burden of explaining the news to someone and labeling them, hey, you might be crazy, huh? You know, and that is burdensome. So what do you think is on the physician's end? Why do you think they don't tell them?
I'm happy that you used the word stigma, because where I come from, I think the psychological illness is still a big issue, and not everyone, whether is aware that they can actually get a lot of help just by going to a therapist. Something can really change, their whole life can change to a certain extent. And I think we can get a lot of help from the medical field in this area. Like when a client comes for me, for instance, and they're just discussing some symptoms, I usually ask them to check with a physician as well to make sure that we're not missing anything. So I really hope that it would be happening the other way as well. Like the physician would be asking, are you getting help from on your psychological, on the psychological level? Are you seeing a therapist? Are you aware that working on your mental health can really help you with your with whatever you're dealing with? So I think awareness on both sides is very important.
Yeah, thank you. I will go back and address the physician side of it at some point, but getting back to the patient side, have you seen how patients receive the news, especially for you, Huma, when they are told that, hey, you've been living with cancer for so long, it's probably given you depression, or it's given your caregivers a lot of anxiety and they're burning out? How has that navigation been for you?
Okay, so see, there is a strong correlation between prolonged chronic illness and mental health. So people with chronic illness are more prone to severe psychological complications. So when any kind of chronic illness, whether it's cancer or a heart disease or any kind of, and not in terms of pediatric, but you know, any age group, when it's diagnosed in a family, so it not only affects the patient, but it affects the entire family system. It affects the patient, their parents, you know, their immediate family, other family members, their sibling. It affects the entire family functioning. Their family life is completely upside down. They don't know what to do. They're in complete shock. They are in denial that it can't happen to them. It can't happen to their child. It cannot happen to them. And there's a lot of denial. There's a lot of shock, and there's a lot of anger towards the doctor if there is a delay in diagnosis, and anger towards God if you talk about spirituality. And if you talk about children, so children, they don't know what's happening to them. There's a lot of fear and anxiety, and unmanaged stress, unmanaged anxiety can lead to further depression, which can lead to other severe medical complications. So it's very hard, actually. So these aspects needs to be addressed, needs to be understood.
Yeah. I'm glad you brought up family though, because that's something I've seen even when I was studying. Nobody ever said, okay, this is an illness, and then this is how it affects you. But nobody ever said this is how it's going to affect your mom.
It affects that it equally traumatizes the entire family system. It not only affects the patient. So we not only deal with the patient, but we deal with the caregivers as well. It's equally important.
Yeah, absolutely, absolutely. For us to see ourselves not just as an individual that is afflicted, but as a system of individuals that have to deal with the aftermath of a diagnosis. And the system of individuals will take it in a lot of ways. Like I've seen in my clinic that if the breadwinner of the family is afflicted, there is a whole different way in which the family deals with the illness versus if the child is affected versus if a grandparent is affected.
There's a lot of dynamics, the finances are affected because they have to, stop their work. They have to take care of the treatment. A family, as I said, a family life is completely upside down.
Actually, that'll bring me to another stakeholder in our illness, which I don't think we consider that well or at all, because I don't know if we have any representations. A bigger stakeholder is also our employers.
Yeah.
All of us got bosses. I got a boss. It's me, but I got a boss. Um, our employers are super affected by the quality of work that the employees will bring up when they have chronic illnesses and then resultant mental health conditions because of those chronic illnesses, right? And they're always wondering, employers' biggest question is productivity. And how do you think, Seema, this is for you because you work in the corporate space so much, are employers able to even identify that a lot of my employees' issues are coming from chronic issues that they're dealing with on their own, that result in mental health issues and reduced cognition, reduced attention spans, etc.?
Pre-COVID, it was a challenge. We did almost 5 years awareness workshop with many corporates in India to make them aware the importance of mental health at workplace. But the COVID actually make all global on one platform. And now the conscious leadership is coming out and leaders themselves are wanting this, that how we can add support to our people. Because definitely it's impacting not only in productivity, but all aspects of life which determine the culture of organization also. So that's where now the conscious leadership and crisis leadership is coming ahead, and they really want their employees to get benefited with the mental health services. So we had seen surge of mental health issues during COVID, which were under carpet before because of the social stigma. In a way, COVID did little positive to mental health in terms of, bringing it on surface. And they have normalized taking therapy and counseling at workplace. Earlier, there were, people used to say, we don't want to come to meet you people at one room because entire team will identify us. So despite putting many efforts in awareness, now thankfully organization and especially the leaders are making therapy normalize. They understood that pain during these two waves where people were losing everybody. They indeed, if I can say, leaders were there for their teams to help. But the most suffered somebody in hierarchy is leaders. The amount of loneliness, fear, being a parent at home, being a son at home to take care of elder parents and then taking care of your team, and they had no one. So indeed, now people are coming for leadership wellness also. That's very heartwarming to see. Now organization had realized that mental health is no longer a dimension of health. It is a core of health. It is a core of well-being of organization. It is a core of right culture. It is a core of organizational health index. And that's very heartwarming. Most of the bigger and conscious organizations are taking these steps. Now organization ask beyond EAP helpline. They are wanting some, measurable products and services where they can add value in people's life. Earlier, wellness was something, something additional to employ. Now this is core to employ well.
Yeah,
So
that we're
that's very
moving away from
beautiful.
perks into
Yeah.
more, this
Now
is
it is
essentials.
essentials. It
Yeah.
is no longer a desirable, it is now a vital part of organization.
Makes a lot of sense. In fact, Marjan was talking about this yesterday, one of the panels as well, about how corporates are more and more open to not seeing this as a deficit, that there's some. Tell me from a HR perspective though, like, does it affect how people grow in organizations? Is there stigma there?
I won't deny, I had to face it for almost 5 years to, encouraging people for coming for one-on-one sessions. That is where we started doing more psychoeducation, where once they are capable of building trust with the therapist, they were coming for one-on-one. But now it's a culture, organization, even leaders, once they come and seek help, so employee also feel it's okay to go and seek help. And beside that, we do many work in psychotherapies and psychoeducation, which really makes, it's a mandatory psychotherapy sessions which everybody has to attend. So once organizations see it in a bigger picture, it is easier for us to deliver, yeah.
Yeah, makes sense. There's actually another big problem. I'm going to call out a lot of you here. There's a deeper challenge among the healthcare fraternity, which is something called diagnostic overshadowing. Seems like it's the process by which healthcare professionals wrongly attribute a person's physical symptoms to their mental illness, and that's very pervasive in medicine. I don't know about the men, but women have certainly faced it, where we've been told our pain is not real, or that it can be more tolerable. Every woman here is going ting, ting, ting in their heads, I can see. 44% of adults with mental illnesses reported being discriminated against or dismissed by their own physicians. Now, that's a huge number for people who are coming to care to feel not cared for. Because care is a feeling, it's not a doing, it's what we feel. And 1 in 5 people may be receiving substandard medical care because of our deeply ingrained stigma. So I'm probably going to ask Linda, what is the community's impact? Because we've had so much chronic illnesses. What is a community as people that are growing towards the future, that are evolving? What is the impact we're having?
This is a very across-the-board question. I think this issue is not only to the physician, but the healthcare system in general. Because we know that when you have a chronic disease, even just one chronic disease, you have 2 to 3 times more possibility of being depressed or anxious. Or if you have 2 or 3 chronic disease, you have a 7 times than general population possibility of getting anxiety or depression. So the impact of this is not only the result for their health, like the way how they're going to respond to the treatment, but also the quality of life of the patient and the way how they take care of themselves. So with all these 3 things, this will affect the family, right? But also their productivity. So as you mentioned, if they are the main source of income in the family, then you're taking it away because they have to take care of themselves. Plus, you need to pay on top of your treatment already if you are found that you have a mental health issue. And in the research, it shows that in the UK, that if a mental health patient has a chronic disease or vice versa, their expenses goes beyond 100% more. Or in the US, it's about 50% more than the general population. So community, I think it's the society, our entire global health is at stake with this mental health issue. And so I think that's the problem, is because the traditional medical school or teaching does not really cover the mental health as what we are facing today. So I think that's where we need to also look at on how to update this system so that we can actually help our population.
Yeah, that makes a lot of sense. I did not know those numbers. And that's very alarming also because there's an economic impact. We're losing trillions and trillions and trillions of dollars.
Yeah, billion actually,
Wow, that's still
per
a lot.
country.
Whoa, okay. Okay, that puts it in perspective. Psychological awareness is where you touched at. That we got to let more people know. That's what Seema has been talking about too. That more corporates needed to be taught first before they were given solutions. You say the same. So I'm gonna go to Mai and ask you, what do you think are the best mediums or best ways in which we can psychoeducate people?
I think it truly depends on the culture. I think we need to reach people in different ways that are appropriate to them. So for instance, from working with the big organizations in Egypt, like UNICEF and organizations like this, we found in the rural areas in Egypt, for instance, the best way is to have people from the villages who actually people know and trust can go and talk to them in person at home. I don't know if anyone here relates to this or not, but I think that we need to put into just acknowledge the fact that not all cultures will accept the same ways of awareness. I think psychoeducation in general is very important, as everyone has mentioned, starting from the physicians themselves. I'd be really happy to know that physicians are getting, especially who work with chronic illnesses, are getting a little bit of when and how can they help or refer their patients to get support on the mental health level. But I'm also aware that there are some people who we need to reach through different ways. For instance, again, if I'm talking about the Middle East, and I'm sure that this might apply to other parts of the world, but I know that, for instance, media and the movies and getting messages indirectly through, and this has actually happened last year in Egypt, where we had a TV show that talked about some of the mental illnesses and very simple information about ADHD, and it has encouraged a lot of people to seek mental health awareness. So I think we all know that there are the normal media channels where you can communicate your messages, but I think as well we need to keep in mind the cultural differences when we're making sure these messages are getting there.
Yeah, absolutely. Like, I think both of you touched upon how cultural differences exist in how we do psychoeducation. Movies and mass media seem to be one of the best ways. Bollywood is moving towards it. We no longer have macho men. Well, we do, but
yeah, but because you were just talking about the stigma, and I think this is part of the problem, because we still see in movies a lot of stigma messages about mental health, and people stay lying down on a chaise-longue and having fun of people who are going to get mental health support. So I think everything ends up at the same message as well. Are you helping or encouraging people to seek mental illness, or are you scaring them from the field, and are you scaring them from the stigma that might be getting? So it's very important.
yeah. And so much so that we have to keep encouraging new age psychologists. I was talking to Joanne yesterday, and we were talking about how hard it is to get psychologists to get out there and talk about themselves, talk about how much they can impact society, and to even like talk to physicians about, hey, this is what I do, and this is how I can do it. How can I help your clients?
Can I chime in?
Chime in, please.
So one of the biggest problem, as I mentioned earlier, is the doctors are kind of away from your practices. I think one of the solution that we can find is integrating mental health with the primary health care services. Make it as one stop, like that when a doctor is partnering with psychologists, they can diagnose it immediately. And it's the same thing into hospitals. But the player that's going to play here are the government or the Ministry of Health, because they need to put that as a policy. And so there's a lot of lobbying that needs to happen to make sure that we are synerging everything so that we can actually have a holistic approach to the mental health with the chronic diseases.
Yeah, like Syed was saying when he accepted his speech in the morning, are there any policymakers here? And we had none. And it's important that they are called in and dragged into the same conversations that we are talking about, because we can go on and on and on, and if there's no policymaker backing it, it's a question.
Don't have time.
So persons who report symptoms of depression also report that they experience 3 times as much chronic physical conditions. So it's not just one way, right? It's not just, I have a chronic condition, so I will develop mental health conditions. It's, I have a mental health condition, and that shows up as chronic physical conditions. And somatoform, that's what we call it, that's also not very well diagnosed by physicians, because they don't know, and they'll just be like, here, take a pill and go. But if you don't follow up, and if you don't have a system that connects, I saw V-Roots, they just done a system on the thing. And if you don't have a system that connects all of these people, then yeah, technology might support for that. Thank you, Friedrich, for the work you do.
They may have a question.
Oh, we're finishing up? Oh, yes, Dr. Paula.
Thank you. Am I audible?
Yes, Dr. Paula.
So thank you for the wonderful session, very enterprising. So there were 2 things. Medicine and psychology is integrated. We practice very much a part of it. Psychosomatic diseases are very well understood, because when we talk about stress, we need to understand that it comes from the point of your belief system, which is your thought, which leads to your emotions, and those emotions create stress, and that stress would raise your cortisol level, and that cortisol level is going to cause inflammation, and that inflammation is finally going to cause your disease process. So the whole thing is got a very clear lining which is there in medical, and we believe it and we accept it. And in fact, there is a very thin line between understanding what is psychosomatic disease and what is the real disease, but we do need to treat the disease also. We can't put it on just psychology, because you have to treat both together.
Yeah.
You have to do your counseling as well as your treatment part at the same time.
Yeah.
So that is
absolutely.
one part of it which I think you need to do. Also, when we are talking of mother's stress, there's something which we would like to add. Probably Dr. Akshay would also like to talk about it. We get a lot of 3rd MBBS students, 1st MBBS students, a lot of social phobia which comes up. He would talk. Stammering, speech delay.
Yeah.
A lot of these would also have a mental issue, a health issue which would be there.
Yeah.
So would you like to speak? I'll pass on the mic to him.
Yeah, please. I remember Dr. Akshay was talking about hypochondria yesterday.
Yeah. So I mean, I had done a small research on my own juniors, because I knew that I was undergoing stress during the medical basic undergraduation. So when I found out, and it was anonymized, and I did it in 2 centers, 2 medical colleges basically, and then it was found that those who just joined medical stream, and in the first year they know that it is highly stressful, new words, new everything basically, and understanding, assimilating it, and then using it later. So then there are many steps therein, and then they get exposed to real patients in the 2nd year. So when they actually get exposed to real patients, first of all, they are stressed, and they may not actually know what to do with their stress. So overall, it has to start with their training as well. So when they start having their medical curriculum as well, so they must be evaluated as well, because that's not mandatorily done.
Yeah,
and,
absolutely.
And that brings up the big part, that why there is a disconnect as well. And starting from the mother's stress, and during pregnancy and even later on. So that part actually is highly neglected as well. And also when it is brought out, most of them have stigma. And stigma is definitely, there in most part of the world. I don't think it's unheard of even in developed countries. So they have stigma, and even, I mean, the insurance companies, I mean, must make sure that those parts are covered. I mean, if
You know,
yeah.
we can talk about like mental health forever and ever and ever, and it'll never be finished. But the one thing I do want to tell you is Dr. Andre was telling me yesterday about how they have virtual settings where they can train students to experience panic situations before they go into panic situations like the birth of a newborn or the death of someone. I really think you should connect with him. Brilliant man. But in the context of chronic illnesses, though, I think the difference is there is a lot of differences between pregnancy, chronic illnesses, and mental health in other spaces versus chronic illnesses.
So in chronic illnesses also, you have your chronic illnesses which start very early in life, maybe 13, 14 years, and
Yeah.
that's why the manifestation will come in your late 20s, 30s, mid-30s. That's why they are called as silent killers most of the time. But the process starts very early, and the process starts initially with, some emotional feelings and things which come up, that which leads to probably psychogenic eating as we call it, or starvation mode, and that's where your malnutrition comes. So it's very, very interrelated. You can't really separate the mental health space from the physical health space. And finally, we are talking about a human being. You can't dissect parts of the human being and say, this is different and this is different.
Oh, I'm glad Western medicine is catching up. Yes.
No, it's not glad. It's always been there, huh? Maybe you were not aware. It's always been there.
60% of persons with mental illnesses die because they have preventable or treatable mental health conditions. We'd really like to reduce that number. We'd like medical professionals perhaps to reach out to the psychologists and ask us, hey, what can you do for us to reduce this number? And I think it's a responsibility of the psychologists and us on this side as well to be able to reach out to medical professionals and not leave them at the lurch of being able, like my dermatologist once said, reduce your stress, you will be better. I said, okay, what do I do for it? I don't know. No, like to be able to go up to them.
So I guess in this, I'm so sorry.
Go for it.
So I think, everything works in a collaboration.
Yeah.
So my career, I started as a patient counselor only in gastro department, where, even the surgeon found that once I am doing counseling beforehand, it was much easier to take them for surgery. Their anxiety was much down, and they did not have any post-operative complications. So once we work in a collaboration, everything is much easier for us, because as Dr. Said very rightly, there is no way to, disintegrate it. In
It's
morning
true.
also we had seen that it is all in your, achar, vihar, thoughts, mind. You can't, disintegrate it. Yes, sir, you wanted to say something.
Yes, a great discussion overall, and I agree to doctors, to psychologists, both. But one thing so far we have been discussing only reactive basis, that, that once somebody has contracted a chronic disease, once somebody has a mental health issue, or even a psychological issue, what can be done and in which direction the industry is heading. My question to you guys are, how do we go proactive on this route? We know, that what is the probability of being a diabetic after 35, after 40, after 45? What is the probability that you'll be suffering from hypertension after 35, 40, 45? So the question to you guys is, how do we go proactive that such issues, if not prevented 100%, but at least deferred by 10 plus years?
May I, Nitin? Yes. Thank you, sir, for asking these wonderful questions. You are very much right. How to make it preventable? I'm just asking a question. Don't take it personally. But if your child comes to you, how many of you would you like to take him to a psychologist when your child is throwing a tantrum at a toy shop? We see it as a behavior. Most of the thing we see it as a behavior because grandparent used to be very, very angry, so it is hereditary, and that's why the child is showing tantrum or very, adamant or angry. None of us would like to take them to a therapist or even try to counsel it. Most of the time we disregard and dismiss these things. So very rightly you said, if we really want to make anything preventive, It must start as early as possible. Now, most of the schools are having school counselors, but still they are not running any preventive thing. It is just a, the tick mark of awareness. There are only tick marks. It's a very, we are, once it is coming to mental health, keeping it as a core of existence, we are still in a very new stage. Even my corporate wellness journey, first 2 years, I did only awareness. The second 2 years, I did only diagnostic and assessment. And after 4 years, I could convince client for interventions in my way. Earlier, it was all reactive. Now, after 4 years of hard work, we are sitting a place where we are proposing and client is accepting because we have something to show them, which is measurable.
That's good to hear. One follow-up question or comment on that.
I think
One thing is the patient, and like
time.
another thing is the caregiver, and somebody touched upon it, like caregiver burden. So in your daily routine practice, how are you making sure or assessing that for a patient, there could be a caregiver with a high level of stress in their home? And how are you like proactively engaging that caregiver to reduce his or her burden?
So,
Can I go? I'll finish in one sentence.
Yeah, sure.
Yes.
Last question, last.
There is just enough diagnostics for caregivers, just as there are for clients themselves, patients themselves. Caregivers also undergo.
So mechanism
these
exists. Sorry to
diagnostics.
interrupt. Mechanism exists. The question is, how many caregivers come? Like, if there are 100 patients coming, how many times you guys are engaging? How many, what is the percentage? That is a minuscule. I don't want to quote the percentage. That how many caregivers are actually seeking a proper medical help for their mental health burden. That's
Not
a very
enough.
minuscule percentage right now.
Not enough.
So, Abhay, to answer your questions, as per my experience, see, I've been dealing with pediatric cancer patients since 14 years as a psychologist. This is what I'm saying. So, around 90% of the caregivers, they require psychological support, but this is one of the most challenging part. Then that they don't acknowledge it. I still find it challenging that because financial need overrides all other needs. Talking about their emotions is a luxury for them because finding a solution for to buy medicine, this is the first thing comes into their mind. But as a support provider, what we have to do, that we have to the services should be available, and we have to let them know that these are the services available, and we have to keep trying. But this is the most challenging part,
I think
actually.
Jerlinda has more.
But first, as an individual, if we are having some problem, first we have to acknowledge our fears, and then we have to be ready to let others know, the professionals, that we are having this problem.
Is the bottleneck is the primary care and the doctors. Let's acknowledge that because they're the one who's going to make the recommendation. Before they go to them, the doctor needs to know what they're doing. So,
All right.
Thank you.
We're out of time, so we're going to stop now. We're all available outside. We can fight this out, but we'd love to have more discussions. Thank you. Have a beautiful, beautiful evening.
thank you.